Greater than 70% of all deaths among American teenagers are preventable and due to three causes: accidents, homicides, and suicides. All of these are strongly linked to the use of alcohol and drugs. According to the 2011 National Youth Risk Behavior Survey, 45% of adolescents have smoked cigarettes, over 70% have consumed alcohol, and almost 40% have tried cannabis. There has recently been a sharp rise in the number of young people who abuse prescription and over-the-counter drugs. Because their brains are still developing, adolescents are especially vulnerable to addiction. We know from research that adolescents can show symptoms of tobacco addiction within the first few weeks of smoking. In addition, alcohol and drugs can permanently change the structure and function of a teen's developing brain.
Hello, my name is Dr. John Knight, and I'm the director of the Center for Adolescent Substance Abuse Research at Children's Hospital Boston. The goal of our research is to develop computer-facilitated strategies for screening and brief intervention for adolescent tobacco, alcohol, and drug use in primary care dental and medical practices. In prior research, we found that a screening, coupled with brief advice from the provider, significantly decreased a teenager's alcohol and cannabis use at the 3 and 12-month follow-ups. We also found preliminary evidence for a motivational enhancement therapy, or MET, program among adolescents in our substance abuse treatment program. In this study, we're testing an integrated, computer-facilitated screening, brief advice, and MET program, which we call iMEt. For this study, we will invite patients 9 to 20 years old coming to your clinic for their annual well visit. Once the patients check in for their appointment, they will meet with a research assistant in a private location to begin the CRAFT screening program on a tablet computer. Patients will then be randomized to either the intervention group or the treatment as usual group. For treatment as usual, the appointment will proceed as normal. Patients in the intervention group will see their CRAFT score and risk level right after the screening, followed by 10 pages of scientific information and real-life stories illustrating the health risks of substance use. Those patients will then hand you the tablet at the start of their appointment. After you enter the password, you'll see the report of their CRAFT screening, followed by a list of suggested talking points. These are meant to guide 2 to 3 minutes of brief counseling, including giving your patient the contract for life. The videos you are about to see highlight some of these talking points and approaches when discussing the risks of substance use with your patient. The patient in the first clip reported no use of tobacco, alcohol, or drugs and is at low risk. In this situation, give praise for not using, encourage continued abstinence, and ask that they never ride with an impaired driver or drive while impaired.
Thanks for filling out the questionnaire about tobacco, alcohol, and drug use. As your doctor, I'm concerned about your health. You reported that you don't use tobacco, alcohol, marijuana, or any other drugs, and that's a great choice and is really important for your health. It's important because tobacco can stain your teeth, it can give you bad breath, it changes the way food tastes, and it can also be harmful to your lungs and your heart. Alcohol can hurt your liver, and alcohol and marijuana can impair your driving. So it's important to remember to not get into a car with a driver who's been drinking or using any drugs, and never drive after using anything. Do you have any questions?
No, I've learned all this at school.
Okay. Well, if you ever do have questions, please let me know.
We recommend a similar approach for patients we consider to be at medium risk. These are patients who report using tobacco, alcohol, or drugs in the past year, but not in the past 90 days. We recommend giving them praise and encouragement for not using now, then briefly mention the health risks for all substances, focusing especially on anything they used previously, and encourage them not to use again. The next segments you're about to see are examples of patients who have used a substance in the past 90 days and are considered high risk. Tell them, as your doctor, I recommend that you stop using tobacco, alcohol, and drugs completely. For those patients who are assigned to the active iMEt condition, tell them that you would like them to complete the 2 iMEt sessions within the next month, online, at a time of their own choosing, and that you will follow along with them.
Hi, Michael.
Hi.
Thanks for filling out the questionnaire about alcohol, tobacco, and other drugs. As your doctor, I'm now really concerned about your health because you reported drinking alcohol and using marijuana. Stopping the use of alcohol, marijuana, tobacco, and any other drugs is probably one of the best things that you can do for your health. You've got soccer camp coming up in a couple of weeks. Marijuana use can really interfere with your lungs. It can also interfere with your motivation, your energy, your memory, and your brain development. Believe it or not, it can also cause you to possibly develop schizophrenia or depression when you're older. What I'd like to have you do is log on to this online computer program that will actually help you think a little bit more about your use of alcohol and marijuana. The website is listed right here on this prescription. What you do is you click on, there's 2 separate parts. Each part is going to take you probably about 20 or 30 minutes to do. I'd like for you to log on and do this in the next couple of days.
Okay. Will my parents be able to see this?
No, it's completely confidential. I'll be able to log on and see what your results were and get a report, but the report's not going to go into your medical record.
I don't think I really want to do this.
Well, take the prescription and think about it. Regardless of what happens, I'd still like you to come back next month so we can talk about things.
Okay.
The next scenario will show a provider giving advice about prescription medication. The scenario involves a dental office, but the principles apply equally to medical and dental settings. Abuse of opioid medications and other prescription drugs is a growing national problem. Adolescents think these are safer to take because they're not illegal drugs. However, they do not fully understand the risk of rapidly developing an addictive disorder. Remind your patients to always take medications exactly as you prescribe them.
I'm going to give you a pain medication today, a prescription for a narcotic. Have you ever taken a narcotic before?
No.
Well, I'll tell you some things about pain medication. Please take it as prescribed because it can be very addictive. It can have other side effects. And it's also important that you do not allow anyone else to take your medication, especially for this pain. Okay? So if you have any problems with the way it makes you feel, please let me know.
Okay.
Whether it is tobacco, alcohol, cannabis, or other drugs, the computer program will identify high-risk patients who are eligible to test iMEt. One group of high-risk patients will be randomized to treatment as usual, and a second will receive just brief counseling during the visit. A third group will receive brief counseling and then be asked to participate in the VU program. They will receive an email with login instructions, information about confidentiality, and a toll-free number for questions. We suggest you tell your patient, I would like you to go home and visit the VU website. This website will help you consider how alcohol or drug use fits into your life, now and in the future. Ask them to complete the 2 sessions, then return for a follow-up visit in 1 month. After their clinic visit, all participants will go back to the study research assistant in order to complete some additional questionnaires.
You, the provider, and the study coordinator will receive an email after your patient completes each iMEt session. The email will prompt you to log into iMEt and review your patient's session. The study coordinator will compose a draft email that responds to the adolescent, either affirming their plan to change or recommending changes to their plan. You may edit the response as needed, then notify the study coordinator to send it. Thank you so much for your willingness to be a partner in this important research. Your participation will help us in the discovery, testing, and dissemination of new strategies that can save many lives. I came into this line of research almost 12 years ago, following the death of the boy I had watched grow up in my home neighborhood. With these strategies, together, we have the power to make a difference. We can preserve many young lives and ensure healthy and productive futures for our patients. Well, Sarah, so congratulations on getting your driver's license. And soon it's prom, and then graduation, and then off to college. I was thinking back that the first time I saw you, I could literally hold you in one hand. And now you're this beautiful young lady with so much promise. As you go forward, please just listen to old Dr. John one last time. Stay away from the alcohol and drugs. You don't need them, and they can only hurt you. And I would hate it if anything happened to you. You're like a member of my pediatric family, and you will be forever. I don't have any patience to spare. So live right, fly high. I'm just looking forward to watching you soar.
Thank you.
Okay.